One of the nandun sa list is mental health issues like depression and anxiety. So in adolescent medicine, it's a subspecialty of pediatrics that encompasses all the problems of adolescents. Suicide, the third leading cause of death among adolescents.
So number 1, sabi nga ni Doktora, depression. So number 2,
we have body image issues. Body image.
Anong mga issues nila regarding body image?
Kasi di ba ito yung period kung saan merong mga pagbabago sa katawan, no? So hindi nila maintindihan.
How do unrealistic images and portrayals on social media contributes to identity crisis, especially our mga adolescents?
Since it was mentioned kanina, they're still navigating this critical period, this challenging period. So social media amplify this concern, body image issues specifically.
Mga example ng body image issues aside from acne, yung mga ano pa nila, mga other body image issues.
Usually yung weight, no? One of them is weight. So they would like to lose weight. They would like to look like their another idol. Lalo na yung mga Korean.
So yan yung hindi kumakain sila. Oh my God, ginagawa ko yun kaya na-admit ako dahil ayaw tumaba.
And then they also access pills online. Yung mga pills sa
Bangkok pills
and there are many other
and other mga weight-reducing drugs.
Weight-reducing drugs pills. that are not FDA approved. No? And then they have access to that.
Yes.
Even
alam ko rin yan. Pero because not only for losing weight but for studying. Kasi
for them to be awake.
For them to be awake, yes. So, yun. So, like ako kasi, may mga patients ako na, for example, they have scars on their legs. So, ang nangyayari, yung minsan the culprit can be the parent also.
Yes.
So, ang ginagawa, si parent, yan, makikinig sa mga advices ng mga neighbors or yung mga friends, and they will use this certain product that they will apply on the scars. So, ang nangyari, puro stretch marks yung legs ng bata. Yes, So, kaming mga dermatologists, wala na kaming nagagawa kasi the condition becomes more permanent in the long run. So, kaya dapat, yung mga parents din, hindi natin din pinuput yung mga children natin or nag-a-advise tayo ng kahit na anong ipapahid.
So yung good health seeking behavior is to address that by consultation with the appropriate professional. I agree kasi madami din with sabi nga on the tip of their fingertips, kaya na nila ma-access yon yung mga videos and all that na walang nag-guide and nagsusupervise. So they will see na madami namang mga views or madaming mga likes, baka ito
effective.
So they will try to buy use anyways.
Kaya yung sinasabi namin, what you see in YouTube or in TikTok, hindi naman yun applicable sa lahat sa atin. So it may do good on other people, but it may also do harm on others. So ano pa yung mga nakikita mo aside from identity, yung sa body image, in terms of identity crisis, ano pa yung mga ibang nakikita mo sa mga bata?
Ngayon, they are more familiar with the sexual orientation. So, yung mga how they dress, they would associate yung expression nila, sexual expression. No, so they will try to dress up according sa yung orientation, yung gusto nila, no? So, and then that poses a risk also kasi nakakaroon ng mental health issues, especially if hindi tanggap ng parents.
At saka yung confusion din.
Yes, and
confusion. How do you call this? Sexual orientation or gender identity?
Sexual orientation and gender identity.
So yun. Although, we respect naman yung tawag nito, how do you call this? Yung preference ng bawat bata. But also, the parents should be aware also kung ano yung pinagdadaanan din ng mga anak nila. Kasi in these times, yun nga, they navigate. Para ka palang nagsusoul searching along the way.
Fluid pa sila actually. Hindi pa very concrete na. Ito na-establish. Ako gusto ko talaga ng babae. I want to identify myself as female. Kasi some, they will be swayed, no? Swayed by social media or kung...
So yan yung nag-experiment sila or parang tinatry muna nila. Ganon, yun. So, dapat pala, ginaguide yung mga bata dito.
Oo, kasi it will also lead to risk-taking behavior. Like, for example, online, they will try to accept invitation from people.
From strangers.
And then at risk for abuse.
Yes,
meron kaming mga ganon.
Kasi, syempre, yung mga bata, madali silang malinlang, in short. So, parang meron lang magbe-message sa kanila ng mga predators. I don't know, tama ba? Predators. Yung, how do you call this? Yun. Kasi, yung mga batang ito, very vulnerable pa talaga sila. So, syempre, i-add sila online. And then, sasabihin na, bibigyan kita ng McDonald's or or snacks or from mga pagkain.
Pambili ng cellphone usually.
Cellphone.
Load.
Load.
Madami yan.
So, that's why may naririnig ako noon sa isang yung 20-20.
Yes, so sad.
Pero, so, they will, that's true they will ask for 20 pesos. Ang kapalit nun, in exchange, sex. Para lang sila magkaroon ng load.
So
kaya nga, dumadami yung mga STD infections, especially among the young. But more than that, yung kinakatakot ko, yung abuse, like rape.
Madami yun.
Kasi very traumatic yun sa bata pag mangyari, especially among mga young girls, very vulnerable.
Hindi guided or supervised. So I have had na kahit you're very intelligent, you're very smart and protected sa bahay, pero you have access and hindi kayo na-guide, your chances are to be victims ganun pa din.
So very high. So ito, mga parents hindi lang sa mga, it goes with all classes, whether sa mga higher socio-economic or even low socio-economic status. So, basta the predators are there. Yun na lang yung masasabi natin. Okay. Paano mo tinutulungan ang mga kabataan na mag-navigate sa kanilang identity crisis sa dulot ng mga idealized images at expectations sa social media? So, normally, in your practice, how do you guide them?
First is you have to assess them. So, I do psychosocial risk assessment. So, I do not directly ask them about that. So, yung heads, yung home, education. So, I asked all the questions. So, medyo mahaba yung consultation namin kasi lahat ng aspeto we have to consider. Kasi, hindi yun lang yung problem. Actually, madami siya na pwedeng patong-patong, or tuhog-tuhog na
That's why your consultation is very long.
Yes,
it can run up to 2 to 3 hours. Para lang for everyone to know. Kasi para din yung, you have a psychiatric evaluation. So you also have your own head's evaluation. Okay. So yun. Sige, tuloy.
Ayun. And then, when I do identify, then do na yun, management about how to go about it, So, usually, it stems from low self-esteem, yung mga body image issues nila. And then, you assess them. So, before telling them what to do, you have to tell them, you have to ask them first, how can we address this? How can I help you? How can, kung ano yung mga strategies na ginawa na on their own, then that's where you will, come in.
So, talagang, meron talagang yung guidance coming from you, assessing all aspects na needed to improve, especially sa mga young adolescents. But when you do that also, does the parents go with the assessment or it's only the adolescent? Kasi di ba, during medicine, if I remember, when you talk to adolescents, you talk to them one-on-one.
Yes. So, meron, you talk to the adolescent alone. Pero you have to mention the confidentiality clause and its limits with the companion around, with the parent around initially para alam ng mother, bakit kailangan ako lumabas? Kasi meron kami mga pag-uusapan na information that might not be shared sa inyo. Kung not be shared kung nandyan yung parent. Pero you have to mention that the utmost is safety. So kung merong na-deem na the patient is harmed, may self-harm, may harm to others, or may any form of abuse, then you might have to share that information to the parent or the companion.
So
Pero
then
the rest will be between the two of you.
Yeah. So between the adolescents and the doctor. And then afterwards between the doctor and also together with the parents.
But you still have to ask permission from the adolescent. Kung ito bang pwedeng isabihin ko sa mommy mo. For example, if you identify na nagsisigarilyo yung bata, pero you mention na hindi natin i-share sa mother mo yung ibang information, tas hindi naman siya immediate harm to self. So yan information ay bawal sabihin. So you just work with the adolescent kung paano niya yung kaniyang behavior towards smoking, but you cannot share it. So parang merong ganong factor.
So yan yung mga difference ng attack namin ng mga doctors sa mga children, young children, and then dito sa mga adolescents.
May special na.
Mayroong kasi tinuro sa amin yan. On how to address mga adolescents naman. So number 3, how do social media platforms impact adolescent understanding and exploration of their sexual orientation, such as male-to-male or female-to-female attraction?
Okay. So they are exposed to social media at an early age. So at an early age, some are already familiar with these terms. They're familiar with non-binary, binary. They're familiar with queer. They're familiar with questioning. All these terms are within their fingertips. So alam na nila. They have more information about that. So na-amplify lang yon if, for example, they are shown images and then videos that sa kanila it is deemed okay and maybe appropriate, pero kasi some they have access to unintentional yung forbidden sites like porn, mga ganon, without them actually searching.
Yes.
And there are some who intentionally searches for that, maybe through friends, so and then in return kakaroon sila ng information about misinformation about this, so they will deem na mga male having sex with a male, yung mga ganyan, and all those are okay.
So may question ako, may nakikita ka bang difference na, for example, young children going into adolescence who have less exposure to social media, and then yung sa mga nag-umpisa pa lang, bata pa lang, marami ng exposure sa cellphone, and then going to the adolescent? Or is it still the same? It doesn't matter naman.
Once they have, at an early age, if they are already exposed to that, their chances of being an addict, magiging addict sila. It's like vape, it's like alcohol, na if they're exposed at an early age, the chances of them having substance use disorder is higher. So kung at a younger age, if you're exposed to this, so their mind is not yet mature, so they will think that this is okay lang to watch, and I feel good when I watch this kasi very emotional nga yung teenager. Their brain is not yet developed in such a way na yung reward system for them to feel immediate euphoria, if yung I do this is good, so hindi nila alam pa yung consequences of their actions, of maybe applying those videos that they watch, sa nila, sa personal nila. So hindi pa sila nakaka-distinguish. And
so for me, you advise na mas maganda yung mga young adolescents na wag munang mag-cellphone, as much as possible. Pero hindi ko lang alam kung paano natin maiiwasan.
Pero we cannot, kasi there's still benefits to have information.
Yes.
Connection with friends. So actually, meron siyang benefits, pros and cons.
So it's just that nandun lang talaga tayong mga parents to guide and supervise, or yung mga adults. Yes. So number 4, meron bang particular na mga factors na nagiging sanhi ng pag-confuse ng mga kabataan tungkol sa kanilang sexual identity dahil sa social media, and how do we address itong mga kind of practice? Oh, ang hirap ng Tagalog, ha? Oo. Mga factors, ng sanhi na nagko-confuse regarding their sexual identity because of social media.
So it will go back to them as having one of their tasks is to know who they are. So hindi pa nga nila alam kung sino sila, plus they're exposed to this. So they will be confused. Ano ba ako? Who am I? Tapos they might try to identify kung sino yung nakikita nila online na influencer or na model. Not even social media lang, kahit sa family, sa family and friends also. So all this interplay of factors. So hindi lang siya social media alone.
So usually, what do you advise with this kind of situation? Especially kung nagkakaroon na sila ng identity crisis.
First is you have to have a non-judgmental attitude. So you have to first, so dapat wala kang bias. So pag-approach mo sa kanila, dapat non-judgmental, meaning you're willing to listen to them and then you communicate them with them. Ask them muna kung ano yung how they identify themselves, ano yung mga views nila on this. Then before you say na this is wrong. So we only have to listen. We have to listen first.
That's why very important to go to seek professional help. Kasi yung professional help, hindi naman sila nakakakilala sa inyo. So basically, non-judgmental yung mga to. So yun yung kailangan very important na ma-address din natin. So before this episode ends, I would like to ask, so saan natin mahahanap si Dr. Rajam? For your concerns.
Available here at Youth Plus Medical Center. So every Saturday morning, so that is from 9 a.m. to 12 noon. And I'm also available on Tuesdays and Thursdays beyond 5 p.m. or 5 p.m. onwards. And at EVMC, for those patients who would like to see me then, charity patients, I'm available at EVMC from Monday to Friday during office hours.
And also sa Shalom.
And we also have a clinic at Shalom.
So yun. So guys, so this is it. Thank you, Dr. Rajami. So till next time on my next episode in Dr. Y's Skin Talks. Ay, nakalimutan ko pala. Ano pala ang skincare routine or mga ginagawa mo lang? How do you make yourself young and skin healthy?
I wash my face. I use toner and then I have serum and sunscreen also. But I have yet to have facial and others.
Wow! So yun. So yun yung secret din ni Dr. Bakit maintained youthful pa rin siya. So till then, to my next episode, Dr. Y Skin Talks. This is me, Dr. Y. Bye!